supraclavicular nerves. So what are these? Well, these are what?
Cutaneous
nerves. What does it mean? It means that these go to the skin and receive your skin sensation like touch, pain, temperature, 2-point discrimination, and so forth. Okay, so, and these come out from this area here, okay. And basically this point is also referred to as what point? Herb's point, right? Herb's point. Why? Because if you go down deep to that area, that's where the root of C5 and C6, root of the brachial plexus come out. C5 and C6. And see, when C5 and C6 is damaged, you have the Herb's palsy. Okay, so that's why this area is also referred to as the Herb's point. And this basically coincides at the mid-lateral part of the sternocleidomastoid. So if a surgeon wants to do a surgery to this area, okay, or if he wants to do an application for the like common carotid or internal jugular or external jugular vein, he has to anesthetize, okay, or give like anesthesia to this area so the pain can go away. Okay, so where the mid-lateral point of the sternocleidomastoid, which is also referred to as the Herb's point. Okay. So what else? Superficially, what else do we see here? Is this guy? We talked about this earlier. This is external jugular vein. External jugular vein, just a review. So external jugular vein is formed by. It's formed by.
Posterior division.
Right. Posterior division of retromandibular. So it's not really clear here, but posterior division of retromandibular and posterior auricular. Okay, they come together, and they form the external jugular vein. So external jugular vein crosses the midpoint of the sternocleidomastoid. That's also important. So everybody, feel your sternocleidomastoid. Okay, so midpoint of sternocleidomastoid. So at that point, the external jugular vein basically crosses that muscle. So again, we talked about this earlier. So when would you see the this vein, external jugular vein? When will it be? So I can't see it right now. I can't feel it. Okay, but when would you see it, or when would you palpate it or feel it? When? In what circumstances?
When you have hypertension or the blood goes back. Problem in the heart or
Okay, so
or hypertension.
Okay.
Something like
So the answer for this is that when the external jugular vein it becomes distended, when it gets enlarged. Okay, when it gets enlarged, when it distends, when it gets enlarged and distends, you can feel, you can palpate, you can see it. So what does that mean? It means that you have an accumulation of blood volume in this particular area. And the reason for that, like you said, so there might be a heart problem, okay, like right heart failure. And the example for this is a very good example, so you can memorize it very easily and you can remember it, is that you can this resembles like a traffic jam. Okay, so in front there's a traffic jam, so what's happening there? So the traffic is going slow. So when the traffic is going slow, what happens? Traffic backs up. Okay, so the blood is basically moving slow in the heart. When the blood is moving slow in the heart, due to decreased contraction of the heart. So there's a problem in the heart. Okay, there might be a stenosis of the valves. There might be right heart failure and so forth. So the blood is very slow moving. So it backs up. So one of the areas that backs up, and when you see it, because this is superficial, why can you see it? Because it's superficial. That's why. Just beneath the skin, located in superficial fascia. So when the blood backs up and accumulates in this area, what does it do?
enlarge.
Yeah, it enlarges and it distends, and you can palpate, you can feel. So when you see a person that, if the external jugular vein is distended, and if you can localize and see it from the outside, then you would have to say that there's something wrong with that, his cardiovascular system. Like there might be something wrong with the hypertension, or pulmonary hypertension. There might be something wrong with the heart, okay, or it might be indicative of a pathology in the heart. Okay, so what's this? External jugular vein. Okay, so that's the that's it. Okay, the other thing that is located, okay, there's a muscle located in the superficial fascia in the neck. Who can tell me? Platysma, right. So platysma, so where's platysma located? In the superficial fascia. Okay. It's located in superficial fascia, okay, in the neck. And that's the platysma. And so that's that, platysma. So, okay, you show me the activity of platysma. Show everybody. Okay, so, okay, you show me. Show it. No, like this. Look, see? It's tightened like that. Show it. Okay, you guys, you show it. You show it. Huh? Show it. No. Okay, you're better.
Yeah, my.
Show it. Okay. All right. So you're tightening what? Your neck. Okay. And sometimes so you have the origin and the insertions around here, so it tightens your neck. But when sometimes the mandibular area, the insertion becomes fixed, then so part of it attaches to the sternum and the clavicle, so it basically lifts the clavicle up, and that basically is in respiration too. So sometimes, like I said, so the origin insertion points differs in terms of the flexibility and mobility and the fixation of the origin insertion points. So it might change. So if this is fixed, then it will pull this part upwards, like it would pull the sternum and it would pull the clavicle up, and would increase the thoracic cavity dimension. So that would aid in respiration too, in certain circumstances, like increased breathing, for example. That's platysma. Okay, so the neck, the other rest of the things that we can talk about concerning the neck is the muscles. Okay, let's look at the. So we're going to look at let's look at the right the triangles of the muscles. First, let's look at the anterior muscle. We have the suprahyoid and infrahyoid muscles. Let's look at them first.